Welcome back to the Last Visit First podcast. I have a new guest on the podcast who's pretty new to the home care and the hospice space, doing some really cool stuff. So welcome to the podcast, Amee Devani.
Thank you,
from
Tom.
WellBeam.
Super excited to be here.
Tell us about you.
Well, as you said, fairly new to the home health and healthcare world. We began WellBeam's journey 5 years ago, and really it was born out of my co-founder and I hearing about physician side frustration with some of their workflows when patients left the inpatient world and then were passed off and discharged to the post-acute world. And some of the themes were they would lose visibility into that continuity of care, and they were dealing with stacks of faxes to manage the home health care, hospice care of their patients. And even back in 2020, we knew that there was a better way of doing that than fax and phone tag. So that was the beginning of our journey with WellBeam.
Wow. And so this is how many Home Care 100s for you?
This is my third.
Your third one. Good.
Yeah.
So you don't have to wear that newbie pin anymore.
I'm glad to have gotten rid of the star.
Cool. And what have you learned since you've been here?
I think there's significant, awareness now into that longitudinal patient care. More conferences I've been going to. I think the home healthcare industry is very aware of value-based care models and risk-taking and needing to be able to provide that visibility back upstream to the acute facilities. And I think more and more the comment you made earlier about the need for interoperability. We laugh in this day and age of AI, you can only use AI if you can move data. And if you're using faxes, you can't really do that very well.
Sure.
So that's really kind of where WellBeam sits, is the interoperability between facilities and EMRs and between acute and post-acute.
Yeah, that's right. So you guys are really, I always call you the epic pipe. That's when people ask you what WellBeam does, you're the epic pipe, but you've really focused on how do I get data into Epic and out of Epic to the different providers, no matter what their EMR is. When we first talked a few years ago, you guys were really heavily focused in Southern California and California. I'm sure by now your business has expanded. Tell me more about where you're at.
Yeah, we're really excited. It's been an exciting growth period for us. So yes, you're right. We started with California with some large health systems, Stanford, Cedars-Sinai. Today, we're all down the West Coast, a large health system that has operations across 6 states down the West Coast, in the Carolinas with Advocate Atrium, and then several health systems on the East Coast. So our anchor is always the large health system and their EMR, whether that's Epic, Cerner, Meditech, and then the range of their post-acute network. So as you said, we see ourselves a lot like plumbing and infrastructure with universal adapter plugs on each side.
Cool.
So it doesn't matter what your EMR is, we will work with that.
That's awesome. So if I'm a home health provider, let me just ask it straight up, why do I need you? And then second, how do I get to you?
Absolutely. Well, today, one of your issues will be to get timely orders signed in care plans and authorizations. Typically with paper, it can take 21 days or more. Our average time to signature is about 13 hours. In addition, we allow for direct, easy clinical coordination between a clinician at home with the patient and then the physician following the patient, but end to end through the EMR. So neither side has to leave their EMR to be able to share images of wounds or communicate medication adjustments. And then finally, it's a very big value add for the health system. They also spend a huge amount of manpower on manual workflows with a home health partner. And they also can bill certain codes, which when it's being transacted by fax, they don't get to generate the revenue for as well. So it is a key differentiator, I think, for the home health agency to build that relationship with the health system partner on the other side.
That's great. What'd you do last night here at the show?
My flight got canceled, so I was on a plane.
Oh, man, that's terrible.
So I came into the lobby and the bar was full, and I was like, oh, the party's already on.
Yeah, let's go. This is a great place to meet and network and have a few adult beverages. There's always a live scene here at the Phoenician Hotel. You're one of many people that got their flights got canceled. And so you were coming from California?
Yeah,
There's no snow in California.
No, I know. I don't know.
Must be all the other snow everywhere else. Yeah. We're looking at a mountain outside of us with the sun shining.
Just don't send any photos back home.
It's going to be 80 degrees, this week. So it'll be a lot of fun. Well, all right. If people want to get a hold of you, they want to catch, find you on LinkedIn, those kind of things. How do they get a hold of you?
Yeah. Our website, well co-beam.com, LinkedIn. We're big on social. So absolutely, please do reach out, especially if you're thinking about interoperability with your referral sources.
Cool. And we'll have Cole post those on the show notes so it'll be easy for you to find. But it's well-beam.
Beam.
Yeah, so don't mess that one up. That's a harder one.
Yeah, sure.
Yeah. I'll tell you a funny story. When we first started Maxwell Tech, it was called Maxwell Healthcare Associates.com. We, so I spelled it all the way out. What we found out is most people can't spell associates. They don't know how to type it. And the other side of it is if you do Jennifer.Maxwell or Thomas.Maxwell at MaxwellHealthcareAssociates.com, the number of characters that you can fit into an email thing on most websites is smaller than that. So most people couldn't send us an email. I'm like, oh, we got to change it. So
domain names.
We're
working on it.
Yeah.
We're working on it.
Well.beam is pretty good, but Maxwell Healthcare Associates was terrible. So we changed the name of the company, but that was kind of the driving factor of changing the name. But anyway,
yeah.
Thank you for coming.
Thank you for having me. I really appreciate it.
Talk to you soon.
Yeah.